African sky. Sometimes I feel that you really know me.
Hey, nice to have you with us. It's Mansfield Today on a Wednesday, and being a Wednesday, we take a look at things medical. We're joined by Dr.Vicki Schutte, who is a medical doctor, who's our resident medical doctor here on Mansfield Today. She will also be maybe zooming in other people for specialist advice as well, because as I think it was Lance Brogden was telling me a while back, our advocate who was on yesterday, he was saying that sometimes you need to go to a GP first, and then they need to refer you to a specialist. So we'll zoom in people from all over the place and get their specialist opinion as well. But we're really looking at the issues that are affecting everyday medicine at this stage. So, Dr. Vicki, thank you very much for joining us. Nice to have you in the Mansfield Today studio. With the whole COVID issue doing the rounds, and I really don't want to dwell too much on it, but with winter sort of on top of us now, right? People are unsure of what to do. You know, you get a sniffle or you get a cough, and you go, "Oh, it's COVID," where it may not be.
Yes.
How do we start identifying this?
It's a hard question, because that's what we sit with every day when we see our patients. They come in with symptoms of a cold or symptoms of flu, or wow, I think I've got COVID, and here we have to decide, okay, do we now worry? Do we test the person? What do we say to them? So before 2019 December, before COVID really hit us, it was relatively easy to say, oh, you've got a cold or you've got flu maybe, and that's a problem. Now it all overlaps. So it's a bit of a hard thing. So
So you're saying it's even hard for the doctors.
it's very hard for us. Everyone's confused, and you think, they ask you and you don't really know. You don't really want to say to your patient, I don't know. But that's why it's so important in these times to phone the doctor or to go to the doctor and not just leave it.
Yeah.
Because of exposure to other people, basically. So if you say a person's got a cold, he might have a sniffly nose and sneezing, might not have a fever, feel a bit sore. When you talk about flu, they might have high fevers and rigors and body aches, feel awful. When it's COVID, it can be anything. So it's a very hard one.
Are you seeing, because of this uncertainty that we're living through, are you starting to see a lot of stress-related problems coming out of that?
A lot. It's a huge problem, and I've seen males more so than females even, which is a new thing, because males don't often come to the doctor and complain about stuff. But and it's hard to treat, because the reason for the anxiety and stress is often financial. It's social as well, but often financial. And how do we treat that? So we can support our patients, and there's obviously medication sometimes you can give them, but it's a problem socially. What do you do?
Well, it's interesting that you say that, Dr. Vicki, because a bloke that I know fairly well is in the property business, but he specializes in building clinics for specific purposes. And I didn't realize this. A rehabilitation center for, let's say, alcoholics has a very different spec to a rehabilitation center for drug addicts.
Yeah.
And he said one of the biggest things being built now are rehabilitation centers for people who are being depressed, for depression.
It's a huge problem, and people must come and, they must come and see us. They must come and ask for help. And it's a huge problem, not even just in adults, in the children as well. The kids don't get exposed to to social activities or sports activities, and they really take strain. So it's something to think about.
The flu jab itself, let's move away from the COVID one now.
Okay.
The flu jab itself, have you found there's been an uptake on that?
Yeah, definitely. And I think it's very important for people not to just focus on the COVID vaccine, which is also another story, but you know, to go for your flu jab, I think is very, very important, especially this year. If you can prevent getting ill, prevent all that hype about do I have flu, do I have COVID, whatever, please have your flu vaccine. I think that's very important.
And they are fairly easy to get, aren't they? I mean, you can go down to your pharmacy.
Yes, absolutely.
Oh.
They're very easy to get.
Yeah. Okay, let's come back to these vaccines and vaccinations on a broader level. And I asked this question from also as an informative one, but from a personal point of view, because about 12 years ago, I was diagnosed with chronic lymphatic leukemia, and I went through a period of chemotherapy for that. About 18 months ago, I wasn't feeling well, and I went to my doctor, who referred me to a hospital, and they'd found that my platelet count had dropped radically. As a result of that, I had to go through various bits and pieces of treatment to try and build up the platelet count again. I was referred to a specialist hematologist who said to me that there is a possibility, because they'd found a similar case in Cape Town, that the medication that I was put on, the chemotherapy medication that I was put on 12 years ago, could actually now be responsible for breaking down certain aspects of my immune system. So I think that's where a lot of the concern comes from with not only the flu jab, but also the COVID jab, is people are saying, I don't know what's being put into my body.
Yes. Yeah, that's such a common question, and people are anxious. We've had so many phone calls from patients saying, especially the older people now that's getting their vaccine, should we have it? Will my medication that I'm on be a problem? And so on and so forth. But I really do think we should be positive about these inoculations or injections. We should have them. We really should. You're much more likely to die from COVID than from your injections. So I really do think it's very important that we take this up and try and get our injections if you can.
Have you had your injection yet?
I have.
Yeah.
I have.
Now, just tell me something, because whenever I watch TV news or something and you see them giving these people this jab, everyone seems to be looking really tense and really scared to have the jab. Is it sore?
No, it's not sore at all. But it is strange because it's a bit of a whole procedure before you get it, you know. And the nursing sister said to me, okay, doc, are you ready for this now? And I'm going, I don't know, but give it to me. And it was fine. But then afterwards, they watch you for 15 minutes.
Yeah.
You know, you sit in this room with all the other people, socially distancing. And you think, okay, now I've got it. What's going to happen to me now? It's a bit scary, but you know, nothing happened. Nothing will happen. But it was an experience.
Yeah, I suppose it's always that fear of the unknown.
Yes, I think this is the whole thing about COVID, is the unknown, is the fear of the unknown. But if I may say, people must just remember, because I remember in a hard lockdown when we were so quiet, even the doctors, the hospitals were dead, the doctors were quiet, everyone was so scared to come to us or to go to the hospital.
Yeah.
And people must try not to do that. I mean, the hospitals now have COVID wards that's separated from the other wards, and you must realize that there's definitely the normal medical help is still out there. So don't leave things, you know, because you don't want to go to a hospital or go to a doctor. We are careful, there's procedures in place, and the normal illnesses still happen.
Yeah, that is, I think, what everyone forgets is that they're so wrapped up in the COVID aspect of it that they forget that there are other illnesses that are still around and that still need to be treated. And that our facilities, our medical facilities, have the protocols in place.
Absolutely, absolutely. So they must go.
If there's one, or let's say two things that you would say we need to be attending to right now, in view of what's happening with COVID, what are the two most important things? We've been told, to self-isolate and to wear masks and to wash your hands and all the rest of it. If there are two or maybe three things that you say, these are vitally important, what would you say they would be, Doctor?
I think to look for help early during any illness. I think don't feel that you're going to bug the doctor, bug us, ask us, because if we think you need to go for a test, you must rather do it sooner than later. Now, if this test comes back positive, that's usually a bit of a disaster, more so socially, because of family issues, work issues, and then people just need to realize, you need to suck it up and stay at home. I've had quite a few patients where there's one family member that tested positive and then 3 family members that were negative. And then they still want to know, well, can the other 3 that's negative still go out and work and do their thing? And one must remember that it's possible that a third of our tests we miss. There's like false negatives, about a third of them, which is a bit scary. But anyway, so I always say if it looks like a duck and it quacks like a duck, then it's a duck. so rather do the right thing. I know it might be, it messes up your plans and your work stress and all of that, but rather, stay at home and keep everybody else safe.
Dr. Vicki, thank you very much for your time. Thank you for coming into the Mansfield Today studio. If you enjoyed this, then go to Mansfield Today. That's all one word with the letter number 2 in it. .com and like it, and you can share it with your friends as well. We'll be back next week once again with Dr. Vicki. If you've got any medical issues, then you can pop an email through to us at medical@mansfieldtoday.com, and we'll pass those on to Dr. Vicki, and we'll see if we can help you out with any issues that you may have concerns about. Until next time, thank you for joining us. Goodbye.
So much you can show me.